Nasal polyps are soft, painless, and non-cancerous growth that develop in the sinuses and eventually also in the nose due to an inflammation of the mucosa. Chronic sinusitis can exist with or without nasal polyps. How do nasal polyps affect my health? Nasal polyps may not cause any symptoms, especially if they are small. However, larger one can block the normal drainage of the sinuses, resulting in the accumulation of mucus, which makes sinuses more easily infected. Chronic rhinosinusitis with nasal polyps causes an inflammation of the olfactory smell mucosa that leads to a reduced sense of smell. Treatment for nasal polyps. The goal of nasal polyps treatment is to reduce inflammation that causes the polyps. When the inflammation is reduced, the polyps become smaller or sometimes even disappear. If polyps do not sufficiently shrink or disappear, surgery may be necessary. The use of medication represents the first-line treatment and surgery. Polyps removal is recommended as second-line treatment. Number 1. Medication. Nasal corticosteroids. Corticosteroid nasal sprays are generally prescribed to reduce inflammation. The treatment may shrink the polyps or eliminate them. Number 2. Surgery. The standard procedure to remove nasal polyps is functional endoscopic sinus surgery (FESS). The surgeon will insert a small tube within a tiny camera into a nostril and guide it into the sinus cavities, and the polyps will be removed. During the operation, the surgeon may also remove the disease in addition key areas in order to restore adequate aeration and drainage of the sinuses. Endoscopic surgery is usually performed as an outpatient procedure. Note that even after surgical removal of the nasal polyps, the inflammation may still remain. Therefore, to improve your smell, it is important to continue your medications, because they reduce inflammation of the olfactory mucosa. Why do nasal polyps grow back after surgery? Chronic rhinosinusitis with nasal polyps is a chronic disease. This condition will need constant treatment with corticosteroids to prevent worsening of the symptoms. Unfortunately, in some cases, even the nasal sprays with corticosteroids are not strong enough to suppress the polyps' growth. The Cares and Cures team want you and those close to you to live a healthy, happy life. Your health is a valuable thing. Look after your health and your mind so that you can live your life to the fullest. Remember, you only get one. Please share this with your friends and family, and do let us know what do you think in the comments below. This video is solely for informational purposes. Do not self-diagnose or self-medicate, and in all cases, consult a certified healthcare professional before using any information presented in this video. The editorial board does not guarantee any result and does not bear any responsibility for any harm that may result from using the information provided in this video.